Despite of babies protected in mother's womb, air pollution can still affect the baby who is secured inside. Over 15 millions of births are having premature. That means they are taking birth before 37 weeks of gestation, which is very early. Actually, there are three: a premature birth, term birth, and post-term birth, which means that babies who are born before 37 weeks, it is called premature birth, and who are born at the age of 37 to 40 weeks, it is called term birth. And after that, if the babies are born 42 weeks and after that, it is called as post-term birth. So, yeah, through air pollution, we can see through researchers that many of the babies are taking birth before 37 weeks of gestation, which is in turn affecting them and also to the mother. So in this video, let us learn about how does this air pollution affect the mother and also to the baby who is inside the womb. And also let's understand what are the sources of air pollution. How does this air pollution directly affect the baby who is there inside secured? And what are the solutions? How can we get saved from air pollution? Hi, I am Dr. Chandralekha, Yoga Naturopathy physician, Garbha Samskara coach and founder of Matrudevo Bhava. So in this video, first let's understand how does the mother and the baby get affected through air pollution. So air, especially when mother gets affected or she gets exposed to air pollutants, it directly affects the baby through nutrition also. Whenever she breathes in a lot of microparticles, or it could be pollutants, it contains a lot of gases, especially the carbon dioxide, carbon monoxide, nitrous oxide, sulfur dioxide, and so many pollutants. So if you go deep into it, our blood has higher affinity towards carbon dioxide and carbon monoxide. For example, carbon monoxide has 200 times more solubility when compared to the oxygen, and carbon dioxide has 20 to 25 times more solubility when compared to oxygen. So now you should start thinking that how does this pollutants can affect us and the baby who is inside, right? And also it causes low birth weight of the baby. So whenever the mother gets exposed to pollutants, she starts breathing in a lot of microparticles which are present in the air also she inhales. So those out of those particles which are larger in size, whenever she sneezes or whenever she coughs, it comes out. But those particles which are less than the size of 2.5 microns can be inhaled directly into the lung, and from there it goes into the circulation and reaches the placenta and also to the baby. So when you go deep into it and study it, it shows that even the respiratory system of the baby and the cardiovascular system of the baby is also getting affected. And in turn, when the baby grows up in adulthood, it can have higher chances of getting cardiovascular disorders and respiratory disorders. And also it is seen in many researchers that even the hearing, vision and the mental abilities of like learning, memory are also getting disturbed. So see, when you go deep into it and understand, yeah, air pollution which is affecting us so much, we have to start taking some measures towards it. And also mothers who are also already getting asthma or already have asthma get precipitated because of this air pollution. So we have to take care that how this air pollution can affect us and the baby also inside. Research also shows that autism, which is a major problem for the baby to grow up, and many mental abilities are disturbed because of autism. There are also research shows that mothers who are getting exposed to air pollution, especially in third trimester, it causes autism in the babies. And also it shows that for non-pregnant women, it also causes infertility, which is also a major problem in the present society. So these are some of the problems. How does the baby and the mother get affected? Now let us understand how does the baby who is securely present in the mother's womb get affected through this air pollution. So when the mother breathes in, so it is also seen in one such research that around 5 pregnant women who were non-smokers were examined, and they delivered through C-section because of some reason, and the doctors started researching on the placenta of those mothers. So when they started researching on that, they found that these soot particles which are present in the air through air pollution got lodged in the placenta. So through this research we can understand that even the minute of the particles can be reached into the placenta. That means you can understand how this even gets into the baby. So this is also causing many genetic modifications in the baby. So we have to start giving the best of the best qualities to our baby. But some unknown reason we just get exposed to air pollution, which is a global problem, and still we are giving a lot of pollutants and other irreparable problems to our babies. So we have to start taking awareness on this. Now let us understand from where is this air pollution coming, or what are the sources of air pollution. Pollution sources could be many. It could be indoors and also from the outdoors. First, let's understand what are the sources of air pollution from outside. It could be vehicle exhaust, it could be from industries, it could be from burning trashes from outside, it could be cooking on firewoods, it could be crackers, it could be many things. So we have to start taking care on this. Especially you may be thinking, how does air pollution happen at home? It shows that about air pollution in the home is more like 7 times more greater when compared to outside, because we stay indoors like majority of hearts. So this also affects our health directly and also indirectly. So what could be the sources? It could be the kind of toilet cleaners we are using, it could be the chemicals that we use for cleaning, it could be the kind of cooking we do and the smoke which comes out of it. And there are also bacteria and virus which are present in the carpets, rugs, and also a major problem is dust. Even though we are cleaning every day, a lot of dust gets collected in majority of surfaces of, it could be the flower vase, it could be the articles, it could be anything. So we have to start taking care on the minute things also. Now let us understand like how can we get saved out of this air pollution. I think we cannot change everything in one day or like just in 1 day or 2 days. But as a collective community, we can start having awareness on how this air pollution can affect us and the baby inside. And we should start taking that more awareness into our baby also, that telling it how does this affect, and taking those measures can also prevent a lot of complications for the pregnant mothers and also to the babies. So one thing what we can do is, if you are going for walking, especially pregnant mothers, we ask them to walk a lot, and we also ask them to exercise, and for fresh air we ask them to go out. But what you can see here is, you can go for walking, especially where there is a sufficient greenery, where there are a lot of plants or trees present. So that gives a lot of oxygen to the mother and also fresh air. And the second thing, when you are driving outside, make sure the roads are not too much populated. So you can take those roads which are not too much populated and disturbing with lot of carbon dioxide, etc. And also, if you are going out, check the air quality index. Air quality index is something which describes about the quality of air which you are living in it, whether it is too polluted or whether it is too healthy to go outside. So seeing this, we can understand what is the quality of air. And also we can use the air purifiers at home. So these air purifiers can collect all those pollutants which are even lesser than 0.1 micron. So if this cleans up a lot of air, then it is very healthy for us to breathe in. And also make sure whenever you are going out, you are away from smokers, because passive smoking also affects a lot to the baby and also to the mother. And you should take care about the environment in which you are living, because lot of pollutants, if you are living in such metropolitan cities, make sure that you take proper mask which filters a lot of micro particles in the air which you don't breathe in deeply, right? So these are some major things which you can take care of yourself about air pollution, especially in pregnancy. I ask everybody to take care, but pregnancy is very special condition where it can affect both the mother and the baby. So this is a high time to get awareness, and as a community what we can do is plant more trees in the outdoor, and also make sure you have indoor plants. So this feels very silly that it cannot give much effect, but there's a lot of difference when you start implementing things just than hearing and living it. So start implementing all of these things to make your life better and also give the best of the best features to your baby. If you like this content and you want to learn more about Garbha Samskara and pregnancy and get the scientific evidences from it, please do like the video and subscribe to my channel, Dr. Chandralekha. Thank you.